Have you ever wondered what happens when you mix castor oil with baking soda and apply it to your skin? Most people have no idea, but this simple homemade paste has been quietly helping older adults ease joint pain, soften dry skin, and even improve circulation, right from their bathroom cabinet. I'm Dr. Justin Keller, a physician who works with older adults every single day. And in this video, I'm going to show you how these two ingredients, something you probably already own, can help relieve discomfort, support healthy skin, and make everyday movement feel just a little easier. You'll learn what this mixture actually does to the aging body, the best ways to use it from head to toe, quiet health benefits no one ever talks about, how to make it at home, safely, and, very importantly, who should not use it. Watch all the way to the end. Because the first reason people try this mixture is actually the most surprising and possibly the most powerful. And before we get into the details, take a second and type your city in the comments. I'd love to see where you're watching from. It helps me connect with you more personally. If this sounds helpful to you or someone you care about, tap the like button and subscribe to Glowing Age. It's what helps me keep making practical, meaningful health videos just for you. Let's get started. What this mixture does, and why it matters after 60. What if I told you that 2 ingredients sitting quietly in your kitchen could ease your joint discomfort, soften years of skin damage, and even support circulation in aging legs, without a single prescription involved? I'm Dr. Justin Keller, a urologist who spent the last 15 years working closely with patients over 60. I've seen firsthand that aging gracefully isn't about miracles. It's about small, sustainable choices that ease your day-to-day challenges. That's where castor oil and baking soda come in. Let's start with castor oil. This isn't just an old wives' tale. It's been studied for its anti-inflammatory and circulatory effects. When applied topically, castor oil penetrates deep through the outer layer of skin and works to stimulate the lymphatic system, which plays a key role in flushing toxins and reducing localized swelling. A small clinical trial published in Complementary Therapies in Clinical Practice found that castor oil packs improved symptoms in patients with arthritis by improving localized circulation and reducing stiffness. This matters after 60, when our blood flow naturally decreases and our joints don't recover the way they used to. Castor oil doesn't just sit on the skin, it encourages movement beneath the skin. Now let's talk about baking soda. It's not just for your refrigerator or teeth. Baking soda is a mild alkaline substance that helps neutralize excess acidity in the skin. But even more importantly, it's a natural keratolytic, meaning it helps break down rough patches of skin, especially those on the elbows, knees, or feet that often become tougher with age. So, what happens when you mix them? You get a paste that works as a topical anti-inflammatory and skin exfoliant. A powerful combination that can address multiple age-related concerns in one simple application. I've had patients use this to massage into sore hands, swollen ankles, even minor joint flare-ups. Others use it to fade dark spots and smooth out dry, crepey skin on their arms and neck. The results? Anecdotally strong and, best of all, consistent when used regularly. There's also growing interest in this blend for foot care. As we age, reduced circulation in the feet and legs can cause stiffness, numbness, or fatigue. Rubbing this mixture into your feet, followed by a warm compress, can help stimulate blood flow and soothe inflammation. It's a practice that blends science with self-care, which I find is often where the most lasting benefits lie. It's important to note, this isn't a cure-all, but it is a tool that's inexpensive, accessible, and surprisingly effective. You don't need a fancy spa or a drawer full of creams. Sometimes the most powerful remedies are the simplest. And for those navigating the realities of aging, whether it's joint discomfort, skin changes, or just the quiet desire to feel better in your own body, that simplicity matters. You deserve tools that work with your body, not against it. That's the kind of care I believe in. Everyday uses for seniors. From head to toe, let's get practical. Now that we understand why this castor oil and baking soda mixture works, let me show you exactly how seniors can use it, head to toe, to support comfort, circulation, and skin health in everyday life. We'll start at the top, the scalp. As a urologist, I often see older patients struggling with thinning, brittle hair, a normal part of hormonal aging. But here's something overlooked. The scalp itself often becomes dry and inflamed, especially with years of sun exposure or certain medications. By massaging a small amount of this mixture into the scalp once or twice a week, you can moisturize the skin, reduce flakiness, and encourage healthier hair follicles. The castor oil provides ricinoleic acid, a compound known to support circulation to the scalp, while the baking soda gently exfoliates built-up dead skin cells that can block hair growth. Next, the face and neck. Many older adults come to me frustrated about age spots, dryness, and that papery, thinning skin that's hard to treat with commercial products. This mixture, used very gently, acts as a natural exfoliating mask. Apply a thin layer, leave it on for 10-15 minutes and rinse with lukewarm water. The key here is moderation. Older skin is delicate, so I always suggest testing a small area first. But for many, this helps brighten dull areas, soften rough patches, and even fade discoloration with repeated use over time. Moving down, the hands. This is where I see some of the biggest transformations. Years of use, sun damage, and changes in collagen production often leave seniors with dry, aching, or swollen hands. Rubbing this mixture into your hands, especially at night, can help loosen stiff joints and deeply moisturize cracked skin. Add a pair of cotton gloves overnight, and you'll wake up to softer, more comfortable hands. I've had arthritis patients tell me it helps with morning stiffness more than expensive creams. Now let's talk about the torso, particularly the lower back and abdomen. Here, castor oil shines. Applied as a warm compress with a small cloth, it may help relieve muscle tightness, bloating, and general discomfort, especially in the evenings. For women dealing with postmenopausal discomfort or digestive issues, this can feel incredibly soothing. The combination of heat and anti-inflammatory properties helps promote a sense of relaxation that many seniors tell me lasts for hours. And finally, the feet. This is where the magic really happens for many of my patients over 60. Our feet carry the weight of decades, and they often pay the price in the form of poor circulation, dryness, or even nerve sensitivity. Soaking your feet first in warm water, then applying this mixture as a therapeutic massage balm, can help boost local blood flow and reduce inflammation in areas prone to swelling or pain. The baking soda softens rough soles, while the castor oil deeply hydrates and calms overused tendons. I always recommend ending the day this way if you can. It's simple, comforting, and gives your feet the care they deserve, especially if you've been walking, gardening, or just feeling the weight of the day. The beauty of this remedy lies not in hype, but in how personal it becomes. You can adjust the ratio of ingredients. You can apply it where your body needs it most. And over time, these small acts of care add up. Because when your skin, joints, and circulation feel better, you feel better. In medicine, we often look for big answers. But sometimes, a warm cloth, a quiet moment, and a bit of kitchen wisdom are enough to help someone sleep a little easier, walk a little steadier, or smile a little more. That's not just self-care. That's powerful aging. The quiet benefits no one talks about. Most people think of castor oil and baking soda as household basics. What they don't realize is how many quiet but meaningful changes these two can spark in the aging body, especially when used with consistency and intention. Let me start with something many doctors overlook: the lymphatic system. As a urologist, I pay close attention to how the body handles waste and fluid balance, especially in older adults. The lymphatic system plays a central role here. It helps remove toxins, reduce swelling, and support immune function. But unlike the heart, the lymph system doesn't pump. It relies on muscle movement and manual stimulation to do its job. As we age and become less physically active, this system slows down. That's where castor oil comes in. When applied to the skin, castor oil has been shown in small studies to stimulate lymphatic flow, especially when combined with gentle heat or massage. I've recommended castor oil packs for patients experiencing mild swelling in the legs, puffiness, or abdominal bloating, not as a cure, but as a safe way to gently encourage the body's natural detox processes. And when your body processes waste more efficiently, you often feel better, lighter, clearer, and less inflamed. There's also the matter of circulation, one of the quietest issues in aging. Many seniors live with cool hands and feet, tingling or low-level swelling, simply because blood isn't flowing the way it used to. That might seem minor, but over time, poor circulation contributes to fatigue, muscle cramps, even wound healing issues. By regularly massaging areas like the calves, feet, or lower back with this castor oil baking soda blend, some patients report warmer limbs, less tightness, and greater ease of movement. Part of this comes from the castor oil's deep penetrating properties, which may help open capillaries and ease local inflammation. Part of it comes from the simple ritual of touch, taking a few quiet minutes to care for your body instead of ignoring its signals. But the benefits go beyond the physical. Let's talk about sleep. Poor sleep is one of the top complaints I hear from patients over 60. Often it's tied to discomfort, stiff joints, dry skin, or that generalized restless feeling that keeps you tossing at night. Using this mixture as part of your bedtime routine, especially on your feet, neck, or lower back, can create a soothing, grounding effect. It's not a sedative, of course, but the warmth, the relaxation, and the comfort can help trigger a parasympathetic response, your body's natural rest and digest mode. That makes it easier to fall asleep and stay asleep. Another benefit, improved skin integrity. As we get older, skin becomes thinner, more fragile, and slower to heal. Dry patches, minor abrasions, and even pressure points from sitting or lying down too long can lead to discomfort or infection if left untreated. The castor oil baking soda blend acts as a gentle protector, moisturizing deeply and helping prevent breakdown in high-friction areas like heels, elbows, and hips. It's not flashy, but it works, and in aging skin, prevention is everything. Lastly, I want to mention something not measured by any blood test: emotional comfort. There's a certain dignity in taking time for yourself, in applying something nourishing to your skin, in noticing where your body hurts and responding with care. I've seen it again and again. Patients who start with a small act of physical self-care often experience emotional benefits they didn't expect. Less anxiety, more patience, a greater sense of control. When you live with pain, swelling, or visible signs of aging, it's easy to feel like your body is no longer your ally. But routines like this can change that. They're not about looking younger. They're about feeling respected in your own skin and reclaiming a sense of connection with your body. That, to me, is the most powerful benefit of all, and the one we don't talk about nearly enough. How to prepare it safely at home. Now that you understand what this mixture can do, let's walk through exactly how to make it, and how to use it safely and effectively in your own home. I want you to get the benefits without the guesswork or the risks. Start with 2 ingredients: cold-pressed castor oil and plain baking soda, no fragrances, no added chemicals. You want the simplest, most natural forms. Look for castor oil labeled as hexane-free and 100% pure. This ensures you're getting a therapeutic-grade oil that's safe for topical use, even on sensitive or aging skin. Here's the basic recipe I recommend to my patients. 1 teaspoon of baking soda, 1 to 2 teaspoons of castor oil. The goal is to create a smooth, spreadable paste. Not too thick, not too runny. If it feels too gritty, add a drop more oil. If it's too oily, sprinkle in a pinch more baking soda. Mix it in a small glass bowl using a clean spoon or spatula. Don't use metal if you can avoid it. Glass or ceramic is best to preserve the oil's integrity. Now, before applying it anywhere, here's something important. Do a patch test. Place a small amount on the inside of your forearm or just behind the ear. Wait 24 hours. If there's no redness, itching, or irritation, you're good to go. This simple step is especially crucial for aging skin, which tends to be thinner and more reactive. Once you're ready to apply it, start with clean, dry skin. You don't need to lather it on, just enough to coat the area. Use your fingers or a soft cloth to gently massage it in. For joint pain or inflammation, apply directly over the joint and rub in slow, circular motions. You can also wrap the area with a warm, damp towel to enhance absorption and circulation. Leave it on for 20 to 30 minutes. You might feel a warming sensation. That's normal. If it stings or burns, rinse it off immediately. After the treatment, wash the area gently with warm water and pat it dry. No need for soap unless the skin feels greasy. If you're using it for skin care, like on the face, hands, or feet, reduce the baking soda slightly and focus on areas with dry or rough patches. Avoid using it too close to the eyes, lips, or any broken skin. And remember, this is not a daily treatment. I recommend 2 to 3 times a week depending on how your skin responds. Storage tips. Don't store this mixture for long periods. Castor oil is stable, but once it's mixed with baking soda and exposed to air, its effectiveness can degrade. Make a fresh batch each time for best results. Keep your castor oil bottle tightly sealed, stored in a cool, dark cabinet, not the bathroom shelf where humidity can interfere. A few other safety notes. Do not ingest this mixture. Even though both ingredients are technically edible, this remedy is for external use only. Avoid using it near mucous membranes or sensitive areas like genitals or eyes. If you have a skin condition such as eczema, psoriasis, or open sores, consult your doctor before applying. And if you're on blood thinners or have any condition that affects skin healing, be cautious. What's safe for one person at 70 might not be safe for another at 80. Finally, listen to your body. If the mixture feels too strong, dilute it with a bit of olive oil or reduce the baking soda. If you love the results, you might find yourself turning to this remedy again and again. In the end, this isn't about miracle cures. It's about practical, hands-on care you can do yourself, comfortably, safely, and with the kind of confidence that comes from knowing exactly what's going on your skin. Warnings and precautions, because safety matters. As a physician, I always tell my patients, natural doesn't mean harmless. Just because something is made in your kitchen doesn't mean it's automatically safe for every skin type or every health condition, especially as we age. So before you make this mixture part of your self-care routine, let's go over the key precautions you need to keep in mind. First, and most importantly, do a patch test every time you try a new combination or change the ratio. Aging skin, particularly past 60, is thinner, drier, and more vulnerable to irritation. Even if you've never had sensitive skin before, things can change. Apply a small amount of the mixture to the inside of your arm or behind the ear and wait 24 hours. If there's any burning, redness, itching, or unusual warmth, wash it off and don't use it. Next, let's talk about the baking soda itself. This is a common household product, but it's alkaline, meaning it can disturb your skin's natural pH balance if overused. On younger skin, this might go unnoticed. But for older adults, this can lead to dryness, flaking, or even small cracks in the skin. That's why I recommend using this paste no more than 2 or 3 times a week, and not on consecutive days. If your skin already tends toward dryness or sensitivity, consider cutting the baking soda in half or skipping it entirely, and using just castor oil. Never use this mixture on broken skin, open wounds, or raw areas. I've seen patients apply natural treatments to a scraped area hoping for healing, but baking soda can actually delay skin recovery and cause stinging or burning in damaged tissue. If you have any cuts, ulcers, rashes, or visible irritation, talk to your doctor first. Also, avoid using this mixture near your eyes, lips, genitals, or other mucous membranes. The skin in these areas is much more absorbent and reactive. Even a small amount of baking soda can be too harsh, and castor oil, if it gets into the eye, can cause blurring or discomfort. If you have an existing dermatological condition like rosacea, eczema, or psoriasis, proceed with caution. What soothes one person might flare up inflammation in another. In fact, if you're under a dermatologist's care, always mention any home remedies you're trying. They'll guide you on what's safe based on your unique skin profile. Let's also address a less obvious group: individuals with underlying medical conditions that affect circulation, skin integrity, or immune function. That includes diabetes, peripheral vascular disease, or autoimmune disorders. If you're in this group, even topical treatments can carry a higher risk of complications like skin breakdown or infection. Again, talk to your doctor before starting regular use. One more point that's often overlooked: interactions with medications. While topical remedies are unlikely to interfere with prescriptions, anything that impacts circulation, inflammation, or skin absorption might affect how the body handles other treatments, especially if you're on corticosteroids or hormone therapy. Be transparent with your medical team. That's not overcautious, that's smart self-care. Finally, if you're applying the mixture to someone else, such as a spouse, family member, or someone in your care, check their skin regularly. Look for signs of overdryness, redness, or peeling. Older adults who are immobile or have cognitive decline may not be able to communicate irritation, so visual checks matter. To sum it up, respect the remedy. Just because it's made from natural ingredients doesn't mean it can be used casually or carelessly. With aging skin, a gentle approach is always better. Start slow, test carefully, listen to your body. Because in my experience, real wellness isn't about what you put on your body. It's about the relationship you build with it. And that relationship deserves caution, attention, and care. When to try it and when to skip it, one of the most common questions I get from patients is this: "Doctor, is this actually right for me?" And it's a good question, because not every remedy, even the safe and simple ones, is a good fit for every person. So let's talk about when to give this castor oil and baking soda mixture a try, and when you're better off skipping it. You should consider trying it if you're experiencing mild joint stiffness or general aches, especially in the hands, knees, ankles, or lower back. Maybe you've noticed it when you get up from a chair, or your fingers are slower to loosen in the morning. This mixture, applied with a bit of heat, may offer gentle relief without the side effects of over-the-counter creams. Try it if you're dealing with dry, rough skin, particularly on the elbows, heels, or shins. These areas often suffer as our natural oil production slows with age. The castor oil helps restore deep moisture, and the baking soda offers a subtle exfoliating effect, softening thickened patches and helping skin retain hydration. It's also worth trying if you're noticing age spots, uneven skin tone, or dull texture, especially on the arms, hands, or face. While it won't erase pigmentation overnight, many of my older patients have seen noticeable improvement in skin brightness over weeks of gentle, regular use. Try it if you're looking for a foot care routine that goes beyond trimming nails and washing. As we age, circulation in the feet and lower legs declines, leading to swelling, fatigue, and that heavy leg sensation. This mixture, followed by a warm foot soak or wrap, can encourage blood flow and reduce tension. And finally, consider it if you're simply looking to build a gentle, hands-on wellness routine, something that gives you a sense of comfort, presence, and personal care without depending on pharmaceutical options. Many seniors find it's not just the physical benefits, but the emotional boost of doing something nurturing for themselves that makes the real difference. Now, when should you skip it? Skip it if you have sensitive or reactive skin, especially if you've had previous issues with baking soda, essential oils, or exfoliants. This mixture can be too harsh for those with thin, delicate skin, common in individuals over 70, particularly those with a history of long-term sun exposure or corticosteroid use. Avoid it if you have eczema, psoriasis, rosacea, or open sores. Even natural products can trigger flare-ups in inflamed or compromised skin. In these cases, I always recommend working with a dermatologist before introducing anything new to your routine. Skip it if you've had a recent skin infection, surgery, or are healing from a wound in the area you want to treat. Healing skin needs time and protection, not exfoliation or pressure. Let the tissue rebuild itself naturally without external interference. Also, avoid this mixture if you're currently taking prescribed topical medications for the area in question. Whether it's a corticosteroid cream, antifungal, or a medicated moisturizer, adding this mixture on top can dilute, block, or even interfere with your prescribed treatment. And if you or someone you care for has advanced diabetes or poor circulation, be cautious. Poor skin sensation means you might not notice irritation or damage until it's too late. In those cases, always speak to your physician or wound care specialist before trying new skin treatments. Lastly, skip it if you expect a miracle. This mixture isn't a cure, and it won't replace proper medical care. If you have serious joint disease, vascular issues, or chronic pain that's not improving, this blend may offer temporary comfort, but it won't solve the underlying condition. Here's the bottom line. Castor oil and baking soda can be a valuable tool, but it's just that, a tool. And the best tools are used by people who understand their limits. If you feel curious, if you've tested your skin, and if you're willing to start slow and listen to your body, then yes, this might be something worth adding to your care routine. But if you're unsure or your skin or health conditions are more complex, ask your doctor first. That's not caution, that's wisdom. And wisdom is exactly what aging well is all about. So whether you're using this mixture for sore joints, dry heels, or just a little nightly relief, remember, aging doesn't mean giving up comfort. It means finding smarter, simpler ways to care for your body with the wisdom you've earned. Castor oil and baking soda may not be new, but how you use them today can make a difference in how you feel tomorrow. If you learned something helpful today, please like this video and subscribe to Glowing Age. It helps me bring you more trusted, doctor-led content that respects where you are in life and where you're going. And don't forget, leave a comment below with your city. I'd love to know where this community is growing. Take good care of yourself. I'm Dr. Justin Keller, and I'll see you in the next video.